Hello, everybody. Welcome. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kachoa with PAR5 Physical Therapy here in Randolph, New Jersey, and I've partnered with them to bring you an easy and educational workday session. Today's session is stretching for golfers. A little bit about me. I've been in the PT field as a physical therapist for over 25 years. I got my undergrad in exercise physiology from Rutgers University and my doctorate from Mercy College. And for the past 12 years, I've been working with golfers to improve their game, their performance, and also reduce their risk of injury, their aches and their pains, just to help people move better, feel better, and play better. So without further ado, let's get into it. I'm gonna pull up my slides here. So stretching for golfers. Now, if you've been to any of my talks before, this slide will probably look familiar to you. This is not physical therapy. This is general advice intended for a broad audience, a broad population. But if you are dealing with something specific, an injury, a dysfunction or something, please consult a medical professional, get it assessed, get a thorough physical exam to find out the root cause of your symptoms and get that checked out. All right, so on this alternating pattern of stability and mobility. If this pattern is disrupted, then pain or injury is a result. So for golfers, golf is all about rotation, and rotation occurs around through some of these main parts. If video loads, there it is. It occurs through the pelvis, the hips, and into the thoracic spine, the shoulder. So there's this alternating pattern of the stability and mobility right here. I'll pull up the picture here. What we want, specifically, for example, a lot of the clients that come to see me that do have some type of injury, it's usually in the left shoulder. If they're a right-handed golfer, it's their lead side shoulder, their lead side hip, knee, but the top area of most commonly injured is the lower back. And if you could see here, the lower back is red, and that is classified as a stable segment. If that segment isn't stable, or the abdominal muscles aren't strong enough to withstand all the rotational forces that you're putting into it with the golf swing, then oftentimes you'll have that pain. Now, the second part that happens or causes back pain is that when the segments above or below are not as mobile as they should be. So for example, thoracic spine, the T-spine, which is blue, that should be mobile. You should be able to rotate freely through there. And just as the hip, you should be able to move through the hip and rotate through the hip as much as you can. So if those two parts are stuck, if they're not mobile, they turn into a stable segment. So then your body starts to look for compensations, and that compensations turns out to be an unstable or mobile lumbar spine. And that's something that we want to avoid. All right. So here are some things that we're going to be working on today to stretch. We're going to be mobilizing joints, right? Getting joints to move. We're going to be mobilizing soft tissue, getting all these sliding surfaces to move on one another, lengthen and shorten and contract. And we're also going to work on just stretching. Stretching is basically from taking a piece of tissue from point A to point B and just separate them, making them longer. It's the combination of those three interventions that gives you the most mobility and what we call stretching. All right, let's get into it here. I'm gonna get up into my two-shot. Here we are. So the first thing that we're going to go is we can grab some type of implement, all right? That implement can be anything such as a foam roller, or you can grab a massage gun or a lacrosse ball. We're going to be implementing all three today. So if we're going to be thinking about relaxing soft tissue and stretching stuff out, pull this down so you can see a different angle, then we're going to try and mobilize soft tissue for at least a minute and a half. The minute and a half is something that helps to relax that tissue and prep it for stretching. If you wanted to do some type of soft tissue work to activate prior to activity, then the movements are going to be much different. The pacing is going to be different, and the time is going to be shorter, under a minute. Okay? So let's just say, for example, I've got my massage gun here. I'm going to turn it on, and I'm just going to do my thigh. And you can do this on any body part. Any big muscle, the meat pretty much, and you're going to sweep slowly, get through that tissue, and then each piece of muscle, you're going to go for a minute and a half, 30 seconds, okay? You can also do this to your back. So that's just an example of how that works. You could also use the foam roller to roll out, say, the back part, the hamstring area, where I'm going to lift up my hips and with my hands, and I'm supporting myself with my hands and my foot, and then roll forward and backward. And again, it's going to be a slower type of motion to prep that tissue for stretching. And because the muscle is this three-dimensional piece of meat, we want to not just go forward and backward through here, but we also want to create some shearing. So if I'm going to be on this foam roller for a minute and a half, I just don't want to go up and down. I want to be able to go to the inside of that muscle, up and down there, and then the outside of that muscle, up and down here, and also create some shearing side to side. So that looks like this. I'm just going to keep that muscle on there. My leg is going to be stable. And I'm just going to shimmy myself side to side, which creates a more lateral shearing of that tissue, the superficial tissue on the deeper tissues. All right. If I wanted to do my quadricep, the front part of my thigh, I can get into the stomach and then roll it around like this again, side up and down. I can get onto my lateral quad, get into the medial quad and the adductor, and I can do that shearing where I say if I find a tender spot, a tight area, I can go side to side with that. Okay, so that's an example of doing foam rolling to the body. Now, we're going to use the foam roll also for mobilizing the thoracic spine. We want that to move. So I'm going to start on my hands and knees here. I'm going to put this on my ribs, and I'm going to support my body with my hands, or support my head and neck with my hands behind my head. Elbows are going to stay forward. I don't want my elbows to wing out like that, because that gets the shoulder blades in the way of what we're trying to perform on the thoracic spine, your mid-back. So we're going to separate the shoulder blades by bringing the elbows forward. And then we can start with going up and down, okay? So we're gonna go and just sweep through the big piece of meat here, sweep through going up and down, going a little bit to the left, a little bit to the right, trying to find out some tender spots and feel like we could stay on there and work through a minute and a half of that piece of soft tissue. The other thing that we can do through here is mobilize the thoracic spine into the joint. And because the thoracic spine is such an important part for mobility, you got to take some time to do this. So I'm going to scooch down here and get the foam roller on my lower back. Actually, not on the lower back exactly, but in the lower ribs, all right? So I don't want to go directly on my lower back. Just want to go lower ribs. I'm going to get my hands in that same position, elbows forward, shoulder blades separated, creating some tension in that thoracic spine area, that mid-back. And I'm going to rock back. I'm going to try and bring my head and shoulders down to the floor, being careful not to hyperextend through my lower back. Your body will seek the path of least resistance. So oftentimes I'll have people go through this motion and then just kind of let their lower back go and their abdominals relax and they get a lot of motion. So you want to feel like it's like a seesaw type of situation here, where the abdominals keep the ribs down, keep the back flat and rounded. And we don't want to extend through there. We just want to extend through that segment that I'm working on. I'm going to repeatedly go forward and backward for about 30 seconds or so, and then get to the next level. There's like 12 different levels I want you to get through. So we're going to scooch down a little bit, about 3 inches, and repeat that process through every segment, trying to extend backwards without compromising or extending through the spine, focusing on extending through the mid-back. Going to repeat on the next level, and then repeat through that, okay? So once we loosen up the thoracic spine into this direction, going backwards, then we can start to rotate it. Okay. Oftentimes with everyday posture, we wind up in this slouch position, this rounded chest. And when the thoracic spine is this rounded, it cannot rotate. The joints are designed in such a way that this kind of locks up the thoracic spine. So if we're going to try and do a golf turn in this position, it's not going to be successful. To try and get to a full turn, we're going to borrow from the back, borrow from the arms, and that could change our backswing, and also play around and mess up our plane of swing on the downswing. All right. So once we loosen this up, this mid-back, then we can go into mobilize and stretch the thoracic spine with an exercise called the open book. All right. So we can kind of, I'm going to use the foam roller as a little bit of pillow here. Now, when we rotate through the mid-back, I do not want to rotate through my lower back. To lock out your lower back, I have to flex the hip to round that out as much as possible. Okay, as you can see, my knees are above my hips, and that rounds out my lower back. As we do the exercise, you shouldn't feel any rotation there. all the rotation should occur in the thoracic spine. So I've got my bottom hand here, in this case, because of my left side, I've got my left hand on top of my knees, and that's going to stabilize the knees. I don't want the knees to move. Now I'll lock that out. I'm going to take my right hand, my arm that's on top, I'm going to reach under, grab some rib, and then rotate and pull to my right. So I'm rotating my thoracic spine to my right. And because, again, we are doing a joint mobilization, I'm not going to hold it at any one range of motion. I'm just going to go through, trying to increase that as much as I can. And once I feel like I've got a little bit more mobility through there in my thoracic spine, I want a more aggressive stretch. So I'm going to release the hand and then do it without the hand. Now, oftentimes I see people do this and then just do that. And they start to just move through the shoulder. And they tell me, like, why does my shoulder hurt when I'm doing a thoracic spine stretch? Everything is connected, but there's a lot of compensation if I'm just going to move my shoulder. So what I tell people is that you have to keep your eyes, both eyes, on your hand. And you're going to turn your head, turn your upper back, and then rotate through here, neck, head. And if I cannot keep my eyes on my hands, if I lose sight with one eyeball or I can't see my arm, then I've hyperextended or compensated through the shoulder and not stretched the mid-back. Thoracic spine rotation, just using the arm as a little bit of a weight, but not trying to stretch the shoulder. I'm not trying to get through the shoulder because that creates increased risk of injury to the shoulder. All right. So that I would do for a minute and a half, and then repeat that on the other side. Make sure you're as symmetrical as possible when we talk about thoracic spine rotation. All right. The other thing is for the lower back people. If you have issues with your lower back, you can use a lacrosse ball to get into that soft tissue. So to do that, typically for a right-handed golfer, most of the symptoms would be on the right lower back. So what we do is we put that lacrosse ball on that spot with the border being the spine. We don't want to be on the spine, and we don't want to be on the pelvis or the ribs. We want to be in that meaty side area, typically right above the belt line and where there may be a trigger point already. And once we have that, we're just going to lay on top of it and work on our breathing and kind of shimming my body around to find that trigger point, find that tight spot, and then allow your breathing to inhale, take a deep breath in, exhale long, so that that muscle can relax, okay? The muscle will only relax and lengthen if you allow it to. Oftentimes when we're pushing on a trigger point and it's really tender or painful, we'll just hold our breath and we stop breathing, all right? So contracting the muscle is gonna be counterintuitive to our stretching routine. So increase the mobility when I relax that muscle, find the trigger point, breathe through, and then we're going to start to move the knee. So under my right side, I'm going to move my right knee, let that fall out to the side, and then it'll come back in. I'm going to repeat that maybe about 30 seconds or so. If that's easy, then I'm going to bring my knee into my chest on that same side. As I bring my knee into my chest, I'm going to feel more pressure on that ball, which will release that tight tissue in that right lower back. Okay, so that's going to help mobilize that tissue. I would do that again for about 30 seconds for a total time of about a minute and a half in this position. All right, so we're going to get rid of that and then kind of go through our classic stretches here. We talked about the open book. The next one's going to be a hip flexor stretch. So the hip flexor stretch is something that is related to low back pain and inability for golfers to get into the downswing. It's all about moving the pelvis and activating the glute muscle. If this part of the body is tight, this muscle on the back cannot function because it's working against the tightness of the front. So to stretch out my right hip flexor here, which is a muscle that starts on my lower back, dives through my abdominal cavity and inserts into the front part of my hip. So I'm just going to get into this position. Don't think about going into the stretch first. We want to see, can I assume this position, this half kneeling position, and squeeze this glute muscle? Can I contract that muscle? Good. If I got that turned on, stabilizes the bottom part of that muscle. Then I'm going to contract the abdominal muscle. Right? And when I have that on, that'll stabilize my spine and the top half of that muscle. So since both parts, the insertion and the origin of that muscle are now stabilized with my body with the muscle contraction, I'm going to bring my hip forward. This is when I start to move my pelvis forward and I feel that stretch down the front part of the leg. I'm going to hold that for 30 seconds. Okay. The key points of performance here is that when I have my leg in behind me, that foot needs to be in line with my knee. You can kind of see that in the mirror here on the side. That has to be directly behind my hip. So I have that knee and ankle aligned directly straight. The knee is right below my hip. I contract my glute, contract my abdominals, bring my pelvis forward, and that's going to get us a hip flexor stretch. Now, since we're here, we can start to chain things together and hit upstream of the hip flexor by adding a little bit of thoracic side bending to stretch out a lot of this connective tissue fascia. So same thing goes. We got this contracted, I'm tight. I'm going to bring my left hand up and over, elbow to the ceiling, and side bend away. As I side bend to the opposite way, that's going to get this lateral fascial line stretched out even more. And again, breathing through here, a long exhale, still making that same contraction of those two muscles that we mentioned earlier, and then 30 seconds at the very least to maintain the length of that tissue after we come out of that stretch, okay? And then we could even start to get more fancy by adding rotation. So we're gonna do the same setup, half kneeling, hip flexor stretch, glute engaged, in this case, my right glute, abdominals engaged. I'm gonna bring my pelvis forward. So instead of side bending, I'm gonna rotate my torso to the left over this lead leg. This knee needs to stay still. I cannot open like that. So from here, if I have all of this stabilized, I can put my right hand on my left knee, outside of my left knee, and then pull myself into more rotation as long as I have this on and this on. This has to be contracted. If we lose contraction of the glute or the abdominals, what might happen is that you'll get a little bit of back pain, or you'll be unspecific with this stretch or non-specific with this stretch. We want to get it through the thoracic spine and the hip flexor. We have to stabilize through those key points to get that successful. All right. And then from there, we can go into a child's pose, which will stretch out that lower back even more. We're going to sit back onto the heels, walk our hands forward, head goes down. So we're borrowing this movement from yoga. Again, deep breaths, long exhale to relax the spine. And then we could walk the hands over to the left or right and do a couple of deep breaths at either end to stretch out either side of the spine. And then go into our thoracic rotation as well by doing a thread the needle move, where I take one hand and then thread it through my armpit, try and push that shoulder down as I reach forward with the other hand. So I'm getting thoracic rotation as I get into these positions. And again, experimenting with position, how far, how deep I'm going to go, and also exhaling long as I get into these positions, and maybe even try and hold it for about 30 seconds at each end. Okay, so that's a child's pose with the thread the needle. All right, and then we can go simple stretches that you've probably seen before, like a seated hamstring stretch. That's an easy one. Or you could do the stretch on your back, lying on your back. Same thing, up like this. You can keep the other knee bent, pull that leg up, and then as an added bonus here, pump the ankle to mobilize the sciatic nerve that runs down in between the hamstring muscles down the back part of your leg. All right, so that's a quick little rundown of some stretches that you can do for your golf game to improve your mobility and flexibility.